Now we have the second cervical vertebrae. This is also known as the axis because the odontoid process, this is acting as a pivot around which atlas rotates. The axis is typical in its lower part and atypical in its upper part. It is characterized by three features, that is the odontoid process, the weight-bearing superior articular facets, and the massive bifid spine. The odontoid process or the dens projects upwards from the body and represents the centrum of the atlas. It articulates in front by an oval facet with the anterior arch of the atlas. So here we can see the atlas. It is having a facet on the anterior arch. This facet articulates with the dens of the axis like this. So this forms the atlanto-axial joint. Then there is a transverse ligament of the atlas which lodges in a groove behind the dens and separated by a bursa over here. So these two structures are separated with the help of bursa. Then the tip of the dens is connected to the anterior margin of the foramen magnum by the apical ligament, which is said to be the remnant of notochord, and a pair of alar ligaments which are attached somewhat lateral to the tip, that is these are the diverging ligaments from the dens and are anchored to the lateral margins of the foramen magnum. Then we have the superior articular facets which are weight bearing and encroach on the side of the body and overhung the foramen transversarium. So this is foramen transversarium which is overhanged by the superior articular facets. The superior facet lie on a more anterior plane than the inferior articular facet. The latter occupy a plane in common with the articular facet of the lower cervical vertebrae. Then we have the bifid spine, which is massive and receives, in addition to the ligamentum nuchae, the attachment of 5 pair of muscles like rectus capitis posterior major, obliquus capitis inferior, semispinalis cervicis, multifidus and rotators. The upward extent of the deep muscle of the neck are arrested by the spine of axis, thus making atlas free to rotate around the dens. Each transverse process is smallest in comparison to the other cervical vertebrae, and the tip is directed laterally and downward. This is the foramen transversarium for the passage of vertebral artery. So this is all about the axis vertebrae. Thank you so much for watching.